Hello, good morning, and welcome to this Health Foundation seminar on the vexed topic of overcoming short-termism after COVID-19. How can policymakers better prepare for the future? Almost 1,000 of you registered for this webinar, and so we're really delighted that so many are interested in this topic. And I have to say, as chair, I've been looking forward to it for weeks, so I'm really thrilled about today and what we'll be discussing. My name is Jennifer Dixon. I'm the Chief Executive here at the Health Foundation, and I'm going to be chairing the session today. And in this webinar, we're going to be discussing the question of why government is hooked on the short term, why policymakers need to focus more on the medium to longer term, and absolutely crucially, what would make them do it. Clearly, the COVID pandemic has already shown us that more anticipation, and some have said imagination of potential risks in future would have helped us prepare and manage the emergency better. But while it's so important to prepare for emergency insults to healthcare like coronavirus, it's also really important to prepare for slower burn major threats such as climate change, and also whatever has been the cause of the erosion of health stock of the UK population that has seen life expectancy here stall since 2011, particularly affecting some communities. So addressing these surely needs patience, time, thought, coordination, investment, consistent commitment and strategy over years, not just over a few weeks or months. But too often, as I think we have in front of us, we seem to have had myopia, short-termism, and a focus on tactics, not long-term strategy. We've known this for years, but how could we do better? This is the subject we're working on at the Health Foundation in our Shaping Health Futures programme, and for those of you interested, just check our website there. Anyway, to help us answer some of these rather vexed questions, I'm absolutely delighted to bring you a stellar lineup of some of the leading thinkers and indeed doers in policymaking. So first of all, joining us today is Professor Jonathan Boston. Jonathan is a Professor of Public Policy at the School of Government at Victoria University of Wellington in New Zealand. Jonathan has researched and written extensively on the challenge of governing for the long term, and you can find his really cogent books on Amazon, which I can highly recommend. Jonathan is speaking to us from New Zealand, and we're really delighted he's given up some of his evening to come and talk to us. It's about 9 o'clock at your end, isn't it, Jonathan?
Indeed.
Thank you. And then Jonathan is going to be followed by two experts in UK policymaking. First of all, Dame Sally Davis. Sally is now the Master of Trinity College at Cambridge, and as all of you know, she was formerly the Chief Medical Officer for England and the Chief Medical Advisor to the UK government, standing down recently and, as she put it, dodging the bullet of COVID. Sally will have deep insights as to how to keep a long-term policy focus when working with ministers who, let's say, may have other preoccupations. And Jill Rutter. Jill is a Senior Fellow at the Institute for Government, or IFG. I've known Jill for years, and she's a very experienced, hard-bitten former civil servant, particularly Treasury official, and expert on government policy making. And her work at IFG and other places has focused on Brexit, better policy making, and arm's-length government, amongst many other things. So what we're going to do today in our hour that we have is to have Jonathan set the scene, as it were, with a short presentation, and then have Jill and Sally each giving responses, followed by a panel discussion, which includes some of your questions, which I hope you'll put in the Zoom chat. For those, some of you have already submitted some questions, but for those of you who haven't yet, please just fill them in as you feel during the seminar, and we'll pick them up and try and get to them in the discussion. Meantime, if you have any technical issues in the webinar, please also use the box on the screen to submit them to our troubleshooting team who will help out. And for those of you who are Twitterati, please join the Twitter hashtag, that's hashtag THFFutures, hashtag THFFutures. So I think without more ado, I'm going to hand over now to ask Jonathan to open with some remarks on why policy making is really so difficult and how we could possibly do better. Thank you so much. Over to Jonathan.
Well, good morning, everybody. It's a great pleasure to be part of this webinar, and I'd just like to pay tribute to the Health Foundation for organising this, and also for their stellar work on many important health-related issues. It's also a great pleasure to be participating with Jill Rutter, who I've met on a number of occasions and I'm familiar with her work, and also with Dame Sally Davies. So the topic for my short presentation is long-term decision-making in a short-term world. How can we prepare better for the future? All right, so Jennifer has asked me to focus on 4 questions. First of all, what is long-term decision-making? Second, why does it matter? Third, why is long-term decision-making difficult for governments? And fourthly, how can we better embed long-term decision-making within our political and governance systems? So let me just offer some brief general remarks first, and then I'll go through the 4 questions. These questions are important because obviously poor long-term decision-making has serious consequences and potentially irreversible consequences. We think about issues like climate change. It's a huge topic, and I've only got a few minutes to kind of make some salient points. So forgive me for cutting an awful lot of really important stuff out and just focusing on a few key points. It's important to recognize that lots of people have thought about the issue of how do we encourage better long-term decision-making, whether in governance or in business and so on. So there's a range of literatures we can draw on. Literatures from economics, from politics, from sociology, from philosophy, law, and so on. And it's important that we make use of those literatures because they have insights to offer. The evidence from these various disciplines is that there are no simple answers. There are no simple magic bullets that we can fire that will ensure good long-term decision-making. And we need to be mindful that in the current context, we face some really difficult, challenging policy issues, ones like climate change and biodiversity loss, and of course, the current pandemic. A context where we really do need to be thinking long-term and where we need to be willing and able to make ambitious and proactive decisions with an anticipatory focus. But sadly, in the current context we are in many parts of the world, sound anticipatory governance is difficult. The capacity and the political incentives for governing well for the long term are both low, and that's a real worry. So what is, just a comment on some references that you might be interested in. There's a book that I wrote some years ago, a more recent book by John Kay and Mervyn King that some of you will be familiar with called Radical Uncertainty, which is well worth reading, and another book I've just noted here by scholars from around the world on decision-making under deep uncertainty, about which it would be good to reflect a little more later. But first of all, what is long-term decision-making? I've suggested there are at least 4 key features of long-term decision-making. First of all, in terms of time frame, obviously it involves looking beyond the near term, beyond the immediate, and certainly beyond a single electoral cycle. It may entail planning for decades or sometimes centuries. If you think about sea level rise, well, that's going to be a challenge almost certainly for hundreds of years. In terms of approach, long-term decision-making involves attempting to anticipate future risks and opportunities, to recognize the deep uncertainties we're operating within so that we can't know everything, but at the same time, a willingness to make the best possible use of the most reliable evidence available. In terms of a decision rule, long-term decision-making, in my view, involves attempting to choose near-term options that help protect or pursue long-term interests or are likely to achieve desirable long-term goals. Another way of putting it is to say you eschew making decisions that favor the present over the future and put long-term interests at risk. And finally, of course, long-term decision-making can apply in multiple domains, governmental and non-governmental. So why does long-term decision-making matter? Perhaps it should be obvious. Humanity has the capacity to cause huge, widespread, serious and potentially irreversible harm. And that capacity has increased over the centuries and is continuing to increase. So if we're to avoid inflicting significant harm, we need to be thinking seriously about future risks and vulnerabilities. We need to be anticipating. We need to be using our imagination. If we look around the world, we can see significant variability in the extent to which governments prepare for the future, in the extent to which they seek to mitigate risk, and so forth, in the extent, in other words, to which they do seek to govern for the long run. And just to give one example, compare Alberta and Norway, countries with huge oil and gas resources. One country, Norway, has chosen to apply significant resource rentals and save a significant proportion of the income generated and put it into a sovereign wealth fund. By contrast, Alberta started doing that and then sort of gave up. And the consequence is that Norway now has a huge buffer available to protect its citizens in times of difficulty, whereas Alberta does not. A final point I'd just like to make is that while all policy options in all policy domains have costs and benefits, and arguably there are no optimal or ideal sort of intertemporal choices, some options are clearly preferable in terms of long-term sustainability, fairness, and cost effectiveness. So it's important to seek to do better. Okay, so why is long-term decision-making hard? I've just noted some of the key reasons on this slide, and we could talk at length about any number of these particular reasons. And those of you involved in policymaking will find these points, I'm sure, highly familiar. First of all, as human beings, we tend to be impatient. We have all sorts of cognitive biases, and these lead us to focus particularly on the present. And there's a huge literature in the areas of social psychology and behavioral economics that highlights that. Additionally, we do live in a context of deep uncertainty, situations where we cannot assign probabilities accurately and so on, and where we're faced with huge policy complexity. So it's often very difficult to know what it is best to do. And then there's the problem of dynamic and time inconsistency, the so-called credible commitment problem. If we can't be sure that people will commit to something, then are we going to be prepared to sort of take a long-term punt? Are we going to be prepared to support an initiative which may impose some additional costs in the short run for long-term benefits? But if we doubt that people will stay the distance, then we may not be willing to take that cost on board. Then there's the problems of conflicting values and conflicting intertemporal preferences. There are all sorts of political barriers that make long-term decision-making hard, not least the difficulties of actually imposing short-term costs in order to secure long-term gains, the resistance of powerful vested interests. And if you're in a low-trust environment with significant polarization of views, as is the case, sadly, in many parts of the democratic world now, it is obviously really hard to make good long-term decisions. And finally, there's a class of policy problems, variously called creeping problems, slow burner problems, slow threats, and so on, which are particularly difficult politically to address because they tend to be out of sight, out of mind, and thus there isn't a strong constituency pressing for action. So there's this multiplicity of reasons that make decision-making for the long term difficult. So in that context, what can we do to help enhance the capacity for and the incentives for good long-term decision-making? And in particular, how might we embed long-term decision-making more deeply in our political and other institutions? Well, as I've said before, there's no silver bullet. There's no magic bullet here. We need to think creatively. We need to think across multiple dimensions, and we need to be context specific. Some solutions may be feasible in some situations and not in others. Of the strategies that are available, I've listed some. And they include some very basic things like improving our evidence base, improving our monitoring, improving the quality of our analysis, and including, in terms of our analysis, making sure that we give proper weight to long-term risks and vulnerabilities, including the risk of irreversible consequences. We need to improve our foresight, and of course there's a wide range of foresight methodologies that we can draw on. But as important as that is, it's also really important that we ensure that the results of our foresight are incorporated and integrated into our decision-making processes. Then we can try and strengthen the voices for the future in various ways through the establishment of new and better institutions. And around the world, there are, of course, a variety of institutions designed to kind of speak for the future, to speak for future interests. They include things like the Commissioner for Future Generations, which you have in Wales, long-term planning units and advisory units and so forth. Here in my own country, we have a Parliamentary Commissioner for the Environment and a Commissioner for Children, both, in a sense, voices for the future. So that's one of the various techniques we can employ to try and enhance our focus on the future. Another option, though this raises issues of democratic accountability, is that we can try and insulate certain types of decisions from short-term political pressures, perhaps by transferring the decision rights from governments, from those who are politically elected to independent, non-elected bodies. And of course, we do that with regulatory bodies and have done so for a very long time. We've done it with central banks around the world. And I suppose there's a question, are there other areas of policymaking where there may be a case for shifting the decision rights away from governments, recognizing that that could increase the democratic deficit? Then there's the whole question about how do we create an authorizing environment politically that's going to encourage prudent long-term decision-making? How do we encourage citizens of a country to value the future more than perhaps they might? And how do we encourage trust in decision-making in our political institutions so that it's easier to actually make the kinds of important long-term decisions that we need to make? And how do we encourage shared goals? These are really, I think, critical issues at the moment across the democratic world, where we face significant challenges in terms of polarized communities and a loss of trust in our political institutions. And then finally, and I'll just say a few more words about this on the next slide, we can strengthen and expand the use of what are called policy commitment devices. Policy commitment devices can take a number of forms. They can be procedural or substantive in nature. Procedural commitment devices, for example, would be devices which require people in decision-making roles to do certain sorts of things, but not actually tell them precisely what they have to do. So, for example, may require governments to set targets for climate change or for child poverty reduction or something like that, but don't tell you exactly what the targets are. Substantive commitment devices are those commitment devices which actually have some substantive content. They require, for example, governments to commit to pursuing responsible fiscal policies or sustainable environmental policies with clear and specific criteria that have to be followed. And commitment devices are designed, as the name implies, to try and ensure that people do what they might not otherwise want to do, and to ensure that there are more powerful incentives to stop people reneging on their commitments when perhaps the going gets tough and there are political incentives to renege. So finally, what kinds of commitment devices are there, and what are the ones that we might want to make greater use of in order to embed long-term decision-making better in our government and governance institutions? So I've just listed some of the possibilities here. There are many, many others, but they include having legal requirements for governments to consider the interests of future generations, or to consider long-term environmental considerations or various other long-term outcomes as part of the normal policy process, and that can be applied generally, or it can be applied to very specific policy areas. Secondly, you can have a legal requirement for regular, independent, long-term policy reviews in specific policy domains. Here in New Zealand, we've just instituted legislation that requires government departments and agencies to undertake periodic long-term insight briefings for governments that have to be independent of ministers. Thirdly, you can have legal requirements requiring regular independent risk assessments to be undertaken, climate change risk assessments, national risk assessments, and so forth, and for these to be done in credible, independent ways. Fourthly, you can have requirements for governments to set specific long-term targets, as I've mentioned before, in specific policy domains. Requirements that don't necessarily require or specify what those targets should be, but do require the targets to be set and monitored. Fifthly, you can have legal requirements for governments to adhere to substantive policy rules and commitments of the kind that I mentioned previously, fiscal rules and so forth. Sixthly, you can have legal requirements for governments to adhere to particular principles, like the precautionary principle, somehow defined, and I realize that can be defined in a variety of ways. And of course, many of these things are already incorporated into legislation in various jurisdictions around the world. And then finally, you can have things like legal requirements for governments to maintain or enhance specific capital stocks. And in the UK, I know the Natural Capital Committee has been doing quite a lot of thinking about those sorts of issues. In the United Kingdom context, I've just noted here that the Wellbeing of Future Generations Wales Act 2015 incorporates a whole series of policy commitment devices and institutional arrangements as a vehicle for trying to encourage governments in Wales, obviously, and at the local level as well as at the Welsh government level, to take the long run seriously and seek to better protect long-term interests. So that's probably enough from me, Jennifer. I'm sorry I've gone a little bit over my time, but I hope that sort of set the scene for a discussion. Thank you very much.
Thanks, Jonathan. I think it really did, and you set it out, and I thought it was very interesting that you were discussing this blend of commitment devices at the end in particular. I just had a couple of questions perhaps before I turn to Jill first off to respond. In all your work around the world, do you see any particular governments, countries that do this particularly well? And also, if they do, what forces them, what encourages them to do it? Is it some sort of intrinsic sort of reason that they feel that they ought to address this for their populations? Or is there some sort of extrinsic pressure coming from international agencies in response to, I don't know, Paris Accords for climate or something else to do with infection control? I don't know. So is the signal coming from governments quite weak, or where is it strong? And also, what is the how strong is the international environment to nudge governments to do something?
Well, Jennifer, look, this is a huge question, and
yeah.
I can only make a few quick comments now. If you look globally and you use a range of indicators of performance of governments, economic, social, environmental, and so forth, it is pretty clear that some governments perform much better than others, or at least some countries have much better results than others. And most of you will be well aware that the results in Scandinavia on most important indicators tend to be better than in many other parts of the world. They have better performance in terms of economic outcomes or social outcomes or environmental outcomes. And in terms of protecting long-term interests, and particularly environmental interests, it's pretty clear that the governments of Scandinavia have tended to be on the forefront of taking active measures, whether it's with respect to climate change, biodiversity loss, protecting water, and so on. Why is that? It's not absolutely clear to me, but part of the explanation has to be the political culture of those jurisdictions and their capacity to reach agreement across the different parties on important long-term issues. Now, why have they been able to do that? Well, maybe it's partly because they've been relatively homogenous countries in terms of ethnicity and culture and so forth, at least until recently. Perhaps it's got something to do with the fact that they value science and evidence and rational discourse. perhaps it's got something to do with a relatively egalitarian income distribution, which means you don't have quite so much polarization.
Yeah.
There are all sorts of possible explanations, but I think if we were looking for models, I would be tending to look to your north, or your, I guess it's to your east, to Scandinavia. Having said that, of course, those countries have significant challenges as well.
Thank you so much. Thank you, Jonathan. I'll move now to Jill to respond to what you had to say. And perhaps I can just toss in a pre-remark to Jill to address. And that in some of our work at the Health Foundation, we've been mapping the architecture, the futures architecture, if you like, across the UK government. And taking into account some of the points that Jonathan raised, you know, to what extent do we have horizon scanning? Do we have any of these commitment devices? And if you look at what we've got, it's quite respectable actually across government. There's been lots of activity, but somehow this doesn't seem to add up into the kind of cultural change to take this as seriously as we would like. So comments please from someone who's an arch insider. Thank you.
Okay, well, I'm not sure. I've been an outsider for quite a bit of time now, Jennifer. I was intrigued actually by Jonathan's last answer, because my answer was going to be Singapore. And the thing I would have said then, it was quite interesting. I was at a strategy units round table back probably in about 2011, 2012. And the Singaporean delegation was setting out their 20-year plan their government was committed to. And one of the, I think probably the Australian around the table said, how on earth do you get your government to commit to a 20-year plan? And they said, they know they'll be the government in 20 years' time, which I think actually addresses one of the big issues here, which is, you know, the politics of this. Because actually what Jonathan is proposing is a menu of things to make the politics a bit more tilted in favour of the longer term and against the natural political instinct to respond to current needs. And I think that's the sort of big challenge. We see that particularly, say, on the health side, where, as Dame Sally would know, you know, we can have great prevention plans on health and plans to spend, but every time there's an acute crisis in the NHS and waiting lists are going up, the first place you go is the prevention budget, because actually you don't notice that straight away. You can actually make cuts to some of those services quite quickly, reinvest the funds in and overcome your short-term service problems. And as a government, that's the thing you're being immediately judged on, is actually the delivery of current services. So I think we have to be real on that. But as you said, actually, Jennifer, we do have a sort of mass of commitment devices. We've actually tried quite a lot of the things that Jonathan sent out with varying degrees of success. I was actually just looking, and so I think there are two things you want to distinguish in this. One is your capability to anticipate and look ahead. So can you actually identify those issues? And I think one of the really interesting things there is we've got things like the OBRs, the Office of Budget Responsibilities Fiscal Risk Report, which looks out to 2050. We used to have a very extensive foresight program run by the Government Office of Science. But one of the things, if you go on their website, as I just did, is you notice that's basically sort of almost died a death. And all these sort of nice to haves in government seem to have gone into abeyance since government became massively preoccupied in 2016 with the fallout first from Brexit and now from COVID. So the bandwidth within government for looking at things is not good. It's why actually things like the OBR, the Committee on Climate Change, being externalized, if you like, insulated from that, I think have been quite useful bits. So we do have a bit of capacity to look ahead. Though there are other things where I think, you know, Jonathan mentioned slow burn problems that come on you. You don't really notice they're building up. You could say, not quite the same sort of thing you're looking at, but something like housing problems in the UK, real slow burn. And you can call those sort of boiling frog policy problems. You know, you don't have to address them now. They're quite difficult. Charles Clarke has called those in the too difficult box or whatever. I think it's quite interesting. You look at responses to things. When I was at DEFRA, I was Director for Sustainable Development in the 2000s under the New Labour government. We did a piece of work contrasting the way in which the government responded to terrorist attacks in the wake of 9/11, 7/7 and things like that, with the way it responded on climate change, going to actually have much, much worse long-term effects than conceivably terrorism would. But climate change was always the thing you did last after you'd done every other priority. I think you can see that now in the way in which the government is moving to respond to the pandemic, because the immediate is salient, the long term is not very salient. So what you're trying to do is to raise the salience of that. The bit I would say is, I think Jonathan resorts to huge amounts of legal mechanisms. The problem is, and this is where I'm going to sort of finish, I think, the problem with all of those things is if they don't go with the grain of public, at least tacit public consent, they're not going to survive. One of the advantages, or if you like, disadvantages of the European Union was the European Union was able to set fairly insulated long-term targets and then had very effective, believable enforcement mechanisms, including on governments, because you had the Commission that would take infraction proceedings. Even so, it's incredibly hard to get government to take air quality in cities seriously, even with all that battery of things and the fact that it's clearly having immediate detrimental effects on quality of life and on public health. So it's quite difficult to do that, but it's much more difficult when actually, if any of these commitment devices become really irksome, then the government can just get rid of them if it has a majority. So I think unless they're embedded in a sort of public view that this is actually where we want to go, they're actually quite weakly founded devices. So I would say you need to win the politics that these things matter and are useful devices. But I also wouldn't give up, because we have the really powerful long-term changes are when you actually embed it, you create a dynamic of a mix of government action that then seeds further dynamic change. And I think that's where you see these massively big shifts of things happening. Even the strongest commitment targets, the climate change targets, if you look at the history since the Climate Change Act in 2008, lots of Institute for Government work on that, plug, you'll see one of the really interesting things, this is my final point going to be, the cut across between these sorts of long-term problems and the way in which we organise government. The UK has actually done really quite well on climate change to 2020. We're genuinely one of the world beaters, one of the things the government really likes to say all the time. But it's all been driven out of the climate and energy, now the energy department. In every other area, it's stalled, because if you're the housing minister, the transport minister, it's just not top of your list. And we have a real problem when long-term cuts across the way in which we approach problems in our Whitehall government organisational silos, and you get two drivers of inaction rather than just one.
Thank you so much, Jill. Can I just, before I move to Sally, can I just ask you one thing? So I was interviewing a permanent secretary of an unnamed department, let's say, a year ago before COVID, and I was talking to him about futures planning and, you know, what it's respectable what we have, the architecture, but we don't seem to join the dots. It doesn't seem to be in the culture of decision making. And he kind of leant back in his chair rather laconically and said, what's the counterfactual here? He said, we do enough, we don't need to do more. What would happen if we did even less? Point me to a country that really has benefited from this kind of work. What's the counterfactual? So this was coming from a chief civil servant, not who is arguably one of the people who could be a bulwark against the politics that you were mentioning. So if that's endemic in the civil service, how are we going to move forwards?
I don't think it is endemic. I would hope he's untypical. I would slightly hope he's out of a job now. But anyway, quite a lot of civil servants have moved, so it's quite possible that they are. I think it'd be very interesting if that's still their view now, actually, after going through this experience of a government being massively derailed by something that, you know, was, you know, to some extent foreseeable. I think there's a whole really interesting set of governments about the whether we are recalibrating our views on how valuable it is to invest in resilience after COVID, because I think that will be one of the big changes to come out of this. The danger will be that, as always in Whitehall, we devote it all to another SARS-like pandemic, because that's what we've had this time, and we don't devote it to the next one, or more widely. But I think there will be a recalibration towards the value of resilience, and just how, I don't think anyone would have thought that we could be quite so knocked off course as we have been in the last 6 months. So I think he might be rethinking. But I also think this is an area where actually you need the Treasury to be the champion of long-termism. When I did sustainable development, it always really got me that the Treasury were not on my side about sort of building in actually things that were a force for long-term good, that they are more interested in concentrating on making the short-term numbers add up than actually saying, is this putting the country in the best place to succeed long-term? So I think you need to, hopefully that wasn't the permanent secretary of the Treasury. So
I couldn't possibly say. Thank you so much, Jill. Let's move over to Sally now. Sally, Jill just very helpfully mentioned the word resilience. In one of your recent, I think your very last annual report, there was a nice table at the end showing life expectancy between 1990 and 2040 of various countries ranked, and it showed that the United Kingdom ranked pretty low compared to EU 15. You probably remember the table. It looks as though our health is not as resilient as it is in other countries, and we've seen COVID obviously sprinkled on top of that, really laying bare the disparities and the fragility of some of our health fabric across the nation. So you've clearly, one of your jobs is to look at this and to try to improve the health of the population in various ways, not least obesity, mental health and so on. What are your reflections on coming up against government and trying to argue and change the weather to really address some of these longer term issues? We'll get to COVID later, but these longer term issues that really injure the health fabric. Thank you.
Jennifer, thank you to the Health Foundation for setting up this, and I really enjoyed your talk, Jonathan. Thank you. I think I'd like to reflect on a few things which build, I believe, on what Jill has been saying. You know, in government, politicians want votes, so they're focused on the here and now, and on which constituent or person has talked to them recently and really pushing them. So it is difficult to focus on the longer term things, and you have to think who should do it and how to do it. And I would argue there is a role for think tanks, but if governments don't do enough, they have no ownership and no understanding of it. So it's very important to have that. And in fact, in that same report that you're quoting, the last chapter by Jonathan Grant was on futures thinking, and one of my recommendations was we needed a futures unit for the Department of Health, or for health. Health with a capital H, including improving health. I think there is a problem that we have to face, that for long term you're taking decisions in uncertainty, and that means risk. Risk means trade-offs. And I think that needs a degree of honesty for oneself as a politician or a civil servant and with the public. And I think that's very difficult. Interestingly, as I went through my nearly decade as chief medical officer, I decided that being a clinical doctor from the front line was really useful, because we spend our lives working with patients, taking decisions where there are trade-offs and risks, and you see how it works. But another thing you need is not only the thinking, but the champions for it who can frame it. And I mean, I saw my role as chief medical officer to help build the longer term thinking for the department and the nation. And I actually did frame it that way to me and to ministers through, as I'm saying now, but also then pitching the annual reports to address things that I thought were very important, bringing in experts, stimulating debate, and then coming up with the policy advice. And they had quite an impact, so I think it was worth doing. The other way I found that worked was to bring in experts. So before each chapter of the obesity strategy as it's developed, I would have a workshop bringing in the experts from around the UK, get number 10 sat there and the Department of Health policy people, and show that it was fine not to know. It was fine to ask advice. It was fine to debate the evidence. That is a release for all civil servants and policymakers anyway. But then for them to hear it from the best people who could argue together so they could make up their minds. I found that sort of thing useful. But, you know, you need imagination too. Imagination about what's coming, imagination when dealing with problems. And I don't know that we train our civil servants to have imagination. And we don't have many scientists in the system. And we've demedicalized the Department of Health. At the moment, there will only be Chris plus perhaps one or two who are no longer medically active. And I don't think that that's helpful if you want to think about the longer term, because you haven't got that expertise. Interestingly, you've been talking about climate. The long-term problem that I espoused, of course, was antimicrobial resistance, and the government's made me their UK envoy, special envoy for antimicrobial resistance, because that was one of these slow burner things. And I don't talk about frogs, I talk about lobsters. It's the lobster put in the cold water. COVID's the lobster dropped into the boiling water. But to get action on that has took, I think, about 50% of my time framing it, thinking how to do it, talking to the different ministers in different departments. So it had me as a champion at a PermSec level. So you need the thinking, but then you need how do you get it into the system and the championing, and then you need to have imagination. Perhaps I should stop there, apart from making one point that we might want to come back to. I made it repeatedly, but I'll make it again. How is it that we expect people to insure their lives for mortgages? We as a nation insure ourselves through defense against attack, that we don't insure ourselves and fund the preparations for other shocks, particularly these health shocks, when we know we're going to have a pandemic every 5 years. We have done during this century, and it's going to go on. How is it? And I made that case repeatedly, not understanding why it was so hard. We have an NHS, which is an insurance paid through taxes of an illness service. We have never looked at it properly from the other side.
Thank you so much, Sally. I mean, you mentioned there about, and you've echoed what Jill and Jonathan has been saying about the need to be much more rigorous about assessing risks in the future and have the imagination for that. But presumably the flip side of that is also having the imagination for opportunity. You know, you can think of technology, for example, being a possible, you know, don't know if it's a huge hope, but nevertheless, it's possibility there. So in your experience, even if there were sort of weak signals and weak kind of physiology in looking at risk, was there a stronger signal for looking at opportunity, or do you think it's the flip side of the same weakness that we might have across the civil service, possibly because of pressures on time?
Well, if you want to look at technology, say for medical reasons, you need to be really up to date on the science and where it's going. Yeah. So I'm very lucky that I am, because of the journals I read, the circles I move in. But bringing that in, I remember stopping a Department of Health board some years ago and saying, I have to stop you because today one of the most exciting papers has been published. We have the first molecularly designed drug to treat a cancer, and it was a leukemia. And they all said, does it really matter? And I said, yes, my second husband wouldn't have died if that had been here. It does matter. So then they listened to me. But you have to be able to horizon scan and know. And we don't have a health service that's very good. One of the things I'm very proud of is on genomics, that with Sue Hill's help in NHS England, we've gone from little genomic tests that might be out of date in different labs to a national genomics service with centralized labs, regional and central, and state of the art. But the effort that I put into government to persuade them they needed it, talking to Simon Stevens, and then that Sue Hill personally put in, has been massive to make that move. Why do we have a system of, well, I call them cottage industries, but I was told I should call them artisan industries. And I think that happens in the civil service too. It's too broken up and not enough aware of where science and opportunity is going.
Yeah, and just one thing to pick up finally on that. What you've mentioned is two things which helped you. One was that you had access to a big hinterland of a literature, scientific literature, that could boost your arguments for something. But the second thing I think you said is that you were a professional coming from outside. You know, you actually had your career in another area. You've got some kind of anchor there. Did you find that those two things helped a lot when you really took on the antimicrobial resistance and really got government to listen? Are those things both prerequisite for really making an impact?
Well, it clearly helped me. I mean, it's very difficult to say no to me anyway, but when I start talking about my own patients who died or had problems because of antimicrobial resistance, I made it come alive. It wasn't just stats. So it helped me. But I think there's also, what I didn't see many of my compatriot doctors and scientists doing when they did encounter ministers was thinking about it from the minister's perspective. So I was quite good at saying it about the problem, looking at it from their side. Why would they want to take action? What's in it for them to do this and to burnish their images as we went? Because you've got to find ways of getting them interested.
Jennifer, if I could just come in, it's quite, the position of the Chief Medical Officer is really quite interesting in terms, that is the sort of most independent civil service position we have in many ways, with the Chief Medical Officer's annual report, which doesn't go to ministers for approval before it's published and things like that. And actually, I suggested a bit ago, and Mark Walpert started to do it when he was Government Chief Scientific Advisor, that actually the other scientific advisors should do something similar. Jonathan talked about independent risk assessments, but the CMO is in a uniquely independent position to be able to push the agenda, and Dame Sally did it on AMR, Liam Donaldson did it. You know, we've seen quite interesting critiques of government policy coming from CMOs while still employed in the civil service. And we don't give our other scientific advisors quite that leeway. Some invent it for themselves, a bit like David King did early on. But I think it's be useful actually if more GCSAs and CSAs felt they had, that was part of their role actually, was to annually assess or by the risks facing the department in their area and come together and put something out into the public domain.
Yes, and I think
170 years of history, of course.
And I think Jonathan had this very nice phrase, to strengthen institutional voices. So not just the individual professional lead, but also others outside. And so, I mean, if you think about sort of inequalities in health, a big issue at the moment, what kind of external to government sort of source could there be to hold government's feet to the fire on what's actually happening? And there you have to think of, which institution is big, has the heft, and actually reports to Parliament that might not be within the civil service machine. And of course, ONS is that. So should ONS, rather than PHE, do a running tally of state of the nation on health, for example, is a question I think that's quite live at the moment. Sally, I don't think...
So I proposed that we needed a composite health index to do exactly this sort of thing. Yeah. The Cabinet Secretary commissioned it from ONS, and the beta version goes live later in November. So I've got some of that happening.
Very good. Excellent. Thank you. And Jonathan, do you have anything more to say on that in what you see in different countries about this institutional voices that may not be maybe publicly funded, but outside the government sort of civil service architecture?
Well, I think they're very, very important. And there's institutional voices of different kinds. So, for example, in your context, you have significant capability within your parliament. You have, for example, a parliamentary office for science and technology,
Yeah.
which I would love to have in New Zealand, which has some people of considerable capability. And I don't know, Sally, to what extent you or Jill interacted with those folk, but that's one of many sorts of institutions that's seeking to kind of contribute highly reliable, evidence-based advice into the political system. Could I just make a couple of other comments very briefly, Jennifer? Just to say, look, I agree with almost everything Jill and Sally have said, and I think there's some things that are really important. Jill, you talked about Treasury being important. It's absolutely vital that the key financial advisor to a government, whether it's a Treasury or Ministry of Finance, depending on the jurisdiction, does take a long-term view. And sadly, that has not always been the case. Secondly, Sally, you talked about imagination. We need to encourage imaginative thinking to get people thinking with different hats on, to use De Bono's sort of language. We need to try and minimize sort of group think. Jill, you mentioned Singapore as an example. Yes, I could have mentioned Singapore, but of course it is a sort of quasi-democracy. And I guess I would like to think that democracies can be as successful as Singapore. And somehow Singapore has avoided the tragedy of enormous corruption that often comes with single party dominance over long periods of time. And then final comment is, Jill, you talked about commitment devices and the limitations that they have. And look, I completely agree with you. I mean, in some ways, you only need a commitment device when you've already failed. And commitment devices, in some sense, are going to work better, when the conditions are there for them to work. So, completely agree with you. Having said that, I do think there's ways in which you can structure commitment devices that will help shift the opinion of decision makers, will help shift the political culture over time, and thus help embed, good long-term decision making and thoughtful governance.
Actually, I'm not sure about that. I think commitment devices are actually quite useful as ways, and I think they do affect bureaucracy. The political science literature talks about these sort of windows opening when an issue rises up and people all want to take action. That's certainly what happened in the UK in climate change, happened in other. If you can see to set a long-term goal and give it some institutional buttressing, which was what we did in the Climate Change Act, which has been quite a lot of countries, quite a successful UK export, then you can actually sort of insulate that policy against future changes of priorities to some extent. And I think that is quite a helpful way of riding a bit of momentum, establishing a bit of a ratchet for the next opportunity.
Sure.
We're getting a bit stuck here, so what I'll do is just turn to the questions, because there's so many coming in. Thank you very much. And there's one which we haven't really discussed, which is, of course, politicians, what can shift their opinion is public polling and what the public think. That's who they represent. So there's a good question here, which is, what are the panelists' view about how you might build public support and consent for long-term policies, particularly where there may be short-term costs? Who does this well? I know Finland involves the public in a great deal in their futures thinking, don't they, Jonathan?
Yes, they do. But again, if I could go back to a comment that Sally made, you need champions. you need leadership. You need people who are committed to trying to achieve a good long-term outcome. And then, of course, you need that sort of commitment and leadership to then mobilize public opinion behind it. So I think there's a number of different elements here that have to sort of come together. Things just don't happen automatically, and simply having participatory or deliberative mechanisms doesn't necessarily achieve good results. You have to have some pretty dynamic, visionary leadership as well. And in the case of, just coming back to the case of Finland, you know, they do have this mechanism which requires governments to produce a report on the future every 4 years. Yeah. And they have, as you know, Jennifer, made extensive use of a whole raft of ways of engaging the public through social media, through classic town hall meetings, surveys, and all sorts of things. And I do think that's a good idea. The problem is, what's the counterfactual? What would the situation have been in Finland if you hadn't had that kind of mechanism? Wales had an exercise a few years ago, the Wales We Want. My sense is that was quite significant in shaping the subsequent legislation, the Wellbeing of Future Generations Act in Wales, and perhaps galvanising political effort to sharpen up a vision and to sharpen up ways of achieving that vision. So yes, but it still needs good leadership.
Yeah, and I wonder, Jill, whether or not the people demonstrating on the streets for climate change, climate action, galvanised our government in the climate to nudge it towards the climate goals, or do you think that had no impact whatsoever?
No, I think that that raised. I mean, the interesting thing about climate change is how little attention it gets in Parliament. Becky Willis, who writes on this, said MPs don't like talking about climate change, even if they care about it, because they don't want to look like zealots. And I don't know whether there's a similar thing on some public health issues as well, that people are worried about being branded as nanny status, killjoys, and things like that.
Obesity.
Yes.
So I think
have to read the Spectator and the Times and the Telegraph to have.
But what is interesting, I think, on the involving the public, was this recent experiment that 6 select committees sponsored this big citizens' assembly on climate change, which reported a couple of weeks ago, which actually said if you talk to the public through the options, there is more appetite for measures that would be deemed to be, you know, politically toxic if you talk people through it and you can convince people to do things fairly and stuff. So I think there is some scope for probing where the public really is, rather than assuming where they are. And a lot of the sort of deliberative work that people like Engage Britain are starting to do shows that actually people are much less polarized than the political landscape might suggest. So maybe, you know, maybe our people are more Scandinavian than our politicians are.
Thank you. Sally, would this work on reducing inequalities in health due to poverty, do you think? And would people march on the streets saying, what do we want? We want to end obesity now. Or is there public pressure on any of those things that you think could be useful to muster?
Well, there needs to be. And in fact, the polling shows that adults think that the government should protect their children from obesity. So there is some quite good evidence that we're slowly shifting to a society that knows something needs doing, but is finding it to do it individually, which fits with the behavioural understanding we have that this is a societal, structural issue for many, many of us. But it'll be difficult to move it. I think we have to. Well, clearly we have to. And I think we've got an opening because of COVID, because of the increased risk of death being so dramatic. It shows what obesity does. I mean, I haven't forgotten the uproar when Cancer Research UK did that big program about it's the second greatest cause of cancer after smoking. And people said, you shouldn't say that, that's fat shaming. Well, no, it wasn't. It was in the data, it was factual. And we've just got to wake people up to the fact that being overweight is not good for your health.
Thank you. I've done an appalling job as chair. I've only managed to come to 1 or 2 questions, for which I'm so sorry for all of those watching. But I do want to point out that somebody is watching from the Futures team in the UK Government Office of Science and has said, just wanted to say our foresight programme hasn't quite died a death. And there has been a recent report on the future of citizen data systems. And we do a lot with Go Science, and they're a fabulous outfit. So just to say that. So I'm really sorry. We could go on and on, couldn't we? I think we've had some really useful insights here obviously government can't just do it by themselves, won't do it by themselves. There are a number of ways in which we can up the ante in trying to get more foresight thinking, not just of future risks, but also future opportunities. We need spare capacity, we need more thinking, we need more analysis, we need a whole range of civil institutions to change the weather of the conversations, to try and nudge government towards the right thing. It doesn't look as if there's any silver bullet anytime soon, but I think thinking like this must surely help, and we'll try and play our role at the Health Foundation in our little way to try and nudge people forwards. So thank you very much. So thank you very much to Jonathan, to give up his evening, to Sally and to Jill for joining us today. I thought it was very, very interesting and rich. This programme will run and run. Please look at our website for further work on the subject. The webinar's been recorded, so if you missed it and want to show it to your pals, then we'll let you know when it's ready to view. We'll send you an email afterwards. If you like the idea of the Health Foundation and our work in the area, have a look, and details how to do that will be put on screen in a second. And then finally, I'd like you to invite you to our next event on the 16th of October, which is the launch of our Real Centre. And what this is the research and economic analysis for the long term. It's the OBR for health we've set up for our largest industry, the NHS and the care sector. And we're looking at how to plan resources for the medium to long term. And Andrew Dilnot's going to be kicking that off with a lecture, and we have Camilla Cavendish there to respond. So amongst other people. So thank you. I think that leaves me to say thank you very much. Excellent discussion, and look forwards to more debate in future with you all. Thank you so much.